Every year, over 34,000 men die from prostate cancer in the United States alone. And here's the part that keeps me up at night as a urologist. Most of them had warning signs, signs that were either ignored or worse, dismissed by a doctor. Today I'm going to walk you through the warning signs that get missed, not the textbook ones you've already heard, the subtle ones, the ones that look like something else, the ones that even experienced clinicians can overlook. Stay with me through this entire video because the one you least expect, I'm saving that for sign number 5, could literally save your life or the life of someone you love. Why don't men catch it earlier? This is the question I get from families sitting across from me after a late-stage diagnosis, and honestly, it breaks my heart every time. Here's the biological reality. The prostate gland sits deep in the pelvis, right below the bladder, and it wraps around the urethra. Early tumors in the prostate don't usually press on anything painful. They don't bleed visibly. They just grow quietly. Meanwhile, the symptoms they do cause, and I'm going to show you exactly what those are, masquerade as other completely ordinary conditions. A urinary tract infection, getting older, stress, a long flight, dehydration. That's why I call prostate cancer a silent impostor. It wears a disguise, and the disguise is convincing. Now, before I go through the warning signs, I want to be clear about something. Noticing one of these signs does not mean you have cancer. It means you have a reason to see a urologist. That's it. Information is power, not panic. Okay, let's get into it. The number one reason prostate cancer gets missed early is this. Its first urinary symptoms are identical to BPH, benign prostatic hyperplasia, which is just a fancy way of saying a non-cancerous enlarged prostate. Both conditions can cause difficulty starting urination, that hesitant stop-and-go stream. A weak or interrupted urine flow. Feeling like your bladder never fully empties. Getting up 2, 3, 4 times a night to urinate. A sudden, urgent need to go, and I mean sudden. Now here's what gets missed. Men, and sometimes their primary care doctors, chalk all of this up to age. You're in your 50s, this is normal. And yes, some of it is common with age, but common is not the same as something you should ignore. The red flag I watch for? When these symptoms change. When they get worse over weeks, not years. When they appear alongside any of the other signs I'm about to show you. If you're experiencing any combination of these urinary symptoms, that's your cue to get a PSA test and a prostate exam. Not next year, this year. And trust me, PSA tests are not as straightforward as most doctors explain. I'll tell you exactly what they're not telling you later in this video. Blood in the urine. Blood in semen. Both can be symptoms of prostate cancer, and both are things men frequently don't mention to their doctor because they're embarrassed or because it happened once and then stopped, so they assumed it was a fluke. Here's the medical truth. Even a single episode of blood in the urine, what we call hematuria, warrants investigation. Yes, it can be caused by a kidney stone, a UTI, or vigorous exercise, but it can also be a sign of cancer, not just prostate, but bladder cancer as well, and you cannot tell the difference just by looking. Blood in the semen, or hematospermia, is less common and more alarming to men when it occurs. Most of the time in younger men, it's benign, an inflamed blood vessel, a minor infection. But in men over 50, hematospermia that is recurrent or that appears alongside other symptoms on this list needs to be evaluated. Don't wait for it to happen again. One episode is enough to pick up the phone. This is the one that delays diagnosis more than almost any other sign. Advanced prostate cancer commonly spreads to the bones, particularly the lower spine, the hips, and the pelvis. And when it does, it causes pain in those areas. Pain that feels like back pain. Pain that sends men to a chiropractor, a physiotherapist, a rheumatologist. I've had patients who spend over a year getting treated for a herniated disc before someone finally checked their PSA levels. That's not a failure of the patient. That's a failure of the diagnostic process. The pattern that should raise suspicion: persistent lower back pain, especially at night or at rest, that doesn't improve with movement or rest. Deep aching pain in the hips or pelvis that isn't explained by injury or arthritis. Pain or stiffness in the upper thighs or tailbone area. The critical clue here is the word persistent. Musculoskeletal pain typically gets better with rest or anti-inflammatories. Bone pain from metastatic cancer often doesn't. It's there in the morning, it's there at night. It doesn't fully go away. If a man over 50 has unexplained bone pain anywhere from the waist down, and especially if he also has urinary symptoms, that combination needs a PSA test immediately. I'm going to be direct with you because this is too important to dance around. New or worsening erectile dysfunction, particularly when it comes on relatively quickly and isn't explained by cardiovascular issues, medications, or psychological factors, can sometimes be associated with prostate cancer or prostate disease. Here's why this gets missed. ED is extremely common. It's associated with diabetes, hypertension, anxiety, low testosterone, dozens of medications. So when a man mentions it to his doctor, the instinct is to treat the ED, not to look deeper. What I watch for is ED that is new, unexplained, and accompanied by other symptoms on this list, particularly if there's also painful ejaculation, reduced semen volume, pain or discomfort in the perineum, the area between the scrotum and rectum. These symptoms together paint a different picture than simple ED. They suggest something is happening in or around the prostate gland that deserves investigation. Men, I know these conversations are uncomfortable, but your urologist has heard it all. Nothing you say will surprise us, and what you don't say could cost you years of your life. I promised you the one doctors miss most. Here it is, and it's actually two parts. The first part is systemic symptoms. When prostate cancer has spread beyond the gland, it can cause what we call constitutional symptoms, the kind that belong to dozens of conditions, which is exactly why they get missed. Unexplained weight loss, losing 10 or more pounds without trying. Persistent deep fatigue that sleep doesn't fix. Loss of appetite. A general feeling of unwellness that you just can't pin down. On their own, these could be depression, thyroid issues, anemia, dozens of other things. But in a man over 50 who also has urinary symptoms, bone pain, or any of the other signs I've described, these systemic symptoms are a red flag I take very seriously. Now the second part, and this is the one that frustrates me most as a clinician, the PSA test itself. PSA, prostate-specific antigen, is a protein produced by the prostate gland. Elevated levels can indicate prostate cancer. They can also indicate BPH, a prostate infection, inflammation, or even vigorous exercise before the test. Here's what often doesn't get explained clearly. A normal PSA doesn't rule out cancer. Some aggressive prostate cancers don't produce much PSA. A PSA of 2.5 or 3.0 can still be associated with significant cancer in some men. What matters is not just the number, it's the trend. A PSA that doubles in 12 months is far more concerning than a stable PSA of 5. PSA screening guidelines vary, and that variation causes real harm. Different medical organizations give different recommendations about when to start screening. Some say 50, some say 45 for average risk, 40 for high risk, including Black men who have the highest incidence of prostate cancer in the world, and men with a family history. These men are being underscreened at the population level. That's not opinion, that's data. And your PSA result needs context, not just a cutoff. Ask your doctor, what is my PSA velocity over time? What is my PSA density relative to my prostate size? Have we considered a free PSA ratio? These are the questions that separate an aggressive cancer from a benign condition. A single number without context is not enough. This is the conversation I wish more physicians were having with their patients, Because early detection doesn't just improve outcomes. In prostate cancer, it can mean the difference between curative treatment and palliative care. If you're watching this because you recognized something in yourself or someone you love, here is the concrete action plan. Don't wait for a symptom to get worse. One symptom is enough to make an appointment. You don't need to check every box on this list before you take it seriously. Ask specifically for a PSA test. Don't assume it's part of your routine blood work. In many practices, it isn't automatically ordered. Ask for it by name. Request a DRE, a digital rectal exam. I know, nobody's favorite part of the visit, but a physical exam of the prostate can detect abnormalities that the PSA test misses. It takes about 30 seconds, and it matters. If you're in a high-risk group, start earlier. Black men and men with a first-degree relative, father, brother, diagnosed with prostate cancer should begin discussions about screening at age 40 to 45, not 50, earlier. And if something feels wrong, advocate for yourself. If your symptoms are dismissed and they persist, get a second opinion. A good urologist will welcome the conversation. You are not being dramatic. You are being your own best advocate. I went into urology because I believe in catching things early. Because I've seen what early detection does, it gives people their lives back. And I've also seen what late detection does, and I carry those cases with me. The warning signs I covered today, the urinary changes that looked like aging, the blood that only appeared once, the back pain blamed on an old injury, the fatigue blamed on work stress, the PSA sitting at 4 without context for 3 years, these are real patterns from real patients, and many of them are preventable outcomes. Share this video with the men in your life, not to scare them, to inform them, because information is what turns a late diagnosis into an early one. If you found this useful, subscribe, because my next video is going to walk you through exactly what happens at a urology appointment, so there are no surprises, no anxiety, and you walk in knowing exactly what to ask. I'll see you there. Take care of yourselves.